May 6th meeting of the Lane County Budget Committee to order. At this point, I show all committee members present with the exception of Commissioner Bosevich and Mr. Hazen. So we'll move forward right into the first part of committee business. Ms. Moody, does the budget staff have any additional update for us?
Good afternoon. We do not have anything.
Excellent. I have one thing for budget committee or budget support staff, if we could. I could use some assistance with the agendas with putting some type of marking on them as far as the version when they're updated. Just if we just develop the system, whether it's to put the revised date or the revision number or something, so I can make sure I've got the latest and compare them on screen easily. So I appreciate that.
Yeah, we can do that. Thank you.
Okay. Any other business from members of the committee? Okay.
Chair, I will need to leave a few minutes before 5 today to get to a physical meeting at 5:15. Thank you.
Excellent. Thank you. And so let's go ahead and move forward. Who was that?
Sorry, this is Chris Hazen joining from my phone, having some difficulty in getting to meeting, and I have a hard stop at 4:30 this afternoon.
Excellent. Thank you, Mr. Hazen. I'll make a note of that. And just to check, because my screen's getting pretty crowded, is Commissioner Bosevich online? Okay, so noted. Let's go ahead and move into section 3 of our agenda. Ms. Gavney, are you kicking us off today?
I am indeed. Thank you, Chair and Budget Committee. It's truly wonderful to be back with you again today. As I did yesterday, I think I will go ahead and let you know who from our team is here today to present, rather than have them introduce themselves, and then you'll meet them later in the presentation. So around the table today, in addition to myself, Karen Gaffney as the director, we have Kachina Inman, our assistant director, and Diana Felix, our administration and finance manager. We also have Lisa Willis, who manages our clinical financial services division, Ron Jelm from the community health centers, Carla Tazamel from developmental disabilities, Steve Manila, our human services manager, Jocelyn Warren, our public health manager, and Lisa Nichols, our quality and compliance manager. And the rest of our H&HS leadership team, I believe including Dr. Ludke, our senior health officer, are here in the room for moral support and of course to answer any of the really hard questions that you might have for us today as we go through. Yesterday, we began to tell our story of Health and Human Services with the focus on the public safety part of our department, and we will continue that today, focusing on the rest of the department that focuses more on human services. And I just want to start by saying I could not be more proud of the work that our team does at Health and Human Services. That's both the leadership team that you have a chance to meet during these meetings, but also the 760 or so other employees in H&HS who have done tremendous work with and for our community this last year and into the year to come. They really do amazing work to improve the lives of people in Lane County, and I am proud to be part of that work. So let's go to the next slide, Diana. You saw this organization chart yesterday. The 7 divisions in Health and Human Services that we'll be focusing on today are the ones that are highlighted. And I will just say again that in terms of our values and foundational pillars in how we do this work, integration is a key piece of this. So while they are separate boxes on this chart, a lot of the success we have in community is because of our integrated approach to improving lives in the community. So next slide, Diana. Again, I'm going to go quickly through the slides that you had an opportunity to see yesterday. I would remind you that this is the department-wide budget slide. This is the context within which our public services budget that we'll talk about more today sits. The primary funding for our work in health and human services comes from state and federal resources. The general fund that we do receive is targeted. The largest share goes to our youth services division that we talked about yesterday, and then followed by public health, the Human Services Commission, behavioral health, and then part of one position in our admin division. Next slide. Again, this is the same slide you saw yesterday in terms of our expenditure details. We lean heavily towards personnel expenditures as opposed to materials and services. So we can go to the next slide. And this slide reflects the part of the budget we'll talk about today. So the non-public safety parts of our work are reflected on these two charts. The top two revenue sources for this part of the department remain state and federal funding, the two biggest pieces of that pie. And then on this section, our third slice, largest slice, is fees and charges at almost $20 million. And that is represents a lot of the revenue sources that we're able to generate in many of the divisions you'll hear more about today. And let's just go to the next slide. We talked yesterday about Holiday Farm fire impacts and the response from Health and Human Services during the fire. In the divisions we'll talk about today, we also had some pretty tremendous work that I wanted to lift up for you. When we think about our developmental disabilities services, for years as we have done emergency preparedness for whatever type of emergency we might be confronted with, we know that our people with intellectual and developmental disabilities are some of the most vulnerable in the community. So over the years, we've done a lot of work to make sure we have a good sense of where those individuals are living. And that was very important for us during the Holiday Farm fire and being able to successfully evacuate those individuals who lived upriver and in East Springfield. So significant credit to our staff in DD who rallied to make sure we contacted all of those individuals to ensure their safe evacuation, and then really knew to where they had evacuated and made sure we could provide services to those individuals. And then it also was an opportunity for us to make sure we had current emergency plans for all of our foster providers. And that work is important, not only, of course, in this emergency, but for every emergency that will confront us down the road. Our Human Services Division also had a very significant role to perform at the onset of the emergency, and actually continues to be significantly involved in recovery efforts around the fire. As the board knows, one of the more recent recovery pieces was the purchase of a 50-unit motel in Eugene that currently serves as housing for displaced families. I know the county administrator mentioned that in his budget message. In addition, we dedicated staff to assist those impacted families in securing housing services. And we continue to work on site with families who are living in that hotel, as well as other families who are working to secure housing. We haven't talked a lot about the work in some other parts of our Human Services Division. Our Veteran Services in HSD worked hard to contact all of our fire impacted veterans to help with navigation services and supports. And then our staff in the workforce section of Human Services has some specific dislocated worker grants that they are working hard with individuals, both who have evacuated and those who are still living in the area, to partner with employers to perform restoration and recovery work along the McKenzie River corridor, and being able to recruit and hire individuals from the area to perform that work. And then our our staff being able to provide those individuals with support services, as well as gear like steel-toed boots, weather gear, and other tools and equipment to be able to do that work. Again, I think about the county administrator's message of not letting any crisis be wasted in terms of opportunities. And then finally, our quality and compliance division that Lisa Nichols will talk with you more about houses our data and analytics work, and the staff in that section were critical in mobilizing in support of the data needs of the fire response and being able to quickly do analysis on individuals from that area, as well as fire spread and other things that were useful for our county response. Let's go to the next slide, Diana. We do have some capital improvement plan elements that connect to the divisions you'll hear more about today. While these are, so the first one is clearly in progress, and that's our developmental disabilities building. We had a groundbreaking last month to build that building on the site of the old armory between youth services and mental health, which provides a tremendous opportunity for our staff. DD is currently in the public service building and very much pinched for space. And then our quality and compliance division is in rented space. Both of those divisions will be able to locate on what we think of as our MLK campus now, providing a much better client experience, as well as adequate and appropriate space for those staff. The last three bullets on this slide relate to our community health center, and they're listed as pre-planning, which is true. They are not in the budget at this point, but I can tell you with a high degree of confidence that we expect in this next year to make significant progress on all three of those. The first is a project that I think you've heard about in other settings, and that's our collaboration in South Lane County with Lane Community College, South Lane Mental Health and other providers there, as well as the South Lane School District, to open an FQHC, one of our community health center clinics in South Lane County. And that's an exciting project that as soon as we finalize efforts with the community for raising the capital money, we'll be able to move forward on that project. And then the second two projects are ones that have been on the radar for our community health center for quite some time as opportunities to really improve the services that we're able to provide to our patients. Our full service dental program, we know that dental services are a significant need in the community. Currently, we provide preventive dental services, but we haven't been able to provide restorative services. So that expansion would allow for that. And then additional retail pharmacy options. This is one where we, over the last several years, have hired some clinical pharmacists to help patients and providers with medication management, which has been tremendously helpful. And this will allow us to move to the next stage of that program and really provide more full service pharmacy services. So I am now going to hand it off to Diana Felix, our admin and finance manager, who will lead us through the divisions we'll be presenting today. Diana, we have you on mute, I think. It has to happen at least once every meeting.
I've got too many things going here. Thank you, Karen. And thank you, Chair and Budget Committee. The Administration Division provides centralized leadership and operational support to Health and Human Services Direct Service Divisions. We provide department-wide leadership, strategy, and direction. That happens in our contracts management team, which maintains an extensive in-house and subcontracted service system. Fiscal Services manages the budget, accounting, grants management, payroll, and personnel. Strategic Development focuses efforts to build a portfolio of grant resources, and the Public Information Officer enhances internal and external communication. Our focus for the upcoming fiscal year aligns closely to our strategic plan, which we've been updating. Major initiatives fall into two main buckets. The first is building equity into our daily activities to foster diversity and inclusion. And the second is building organizational infrastructure Some of that work includes developing process navigation, tools, and training. We're fostering collaboration between our divisions. We're addressing deficiencies in recruitment, onboarding, and retention, and improving grants management. As you'll hear from many of our divisions today, Health and Human Services has been particularly hard hit by the COVID-19 pandemic. As the leading agency for disease response and community recovery programs, our work has more than doubled in some areas. All of those efforts are focused through administration in the form of hiring extra staff, managing incoming funds, and related subcontracts, leading the efforts to be as strategic as possible in an ongoing emergency. I'm in awe of the sheer volume of work our teams have taken on and really want to lift them up as we move through this presentation. Now I'm honored to hand you over to Lisa Willis, our Clinical Financial Services Manager.
Thank you, Diana. Clinical Financial Services provides administrative and financial support to Lane County's federally qualified health center and components of youth services. The FQHC includes the community health centers, Lane County Behavioral Health, the medication-assisted treatment programs, and public health, maternal child health, and communicable disease programs. Revenue cycle services include charge processing, payment posting, and AR follow-up for insurance and patient billing. We also coordinate provider and clinic credentialing with federal, state, and commercial plans. CFS is responsible for the configuration and support of the next-gen practice management system, which includes adding new payers, providers, and locations, as well as fee schedule updates and upgrade testing. Grant, state, and federal funds tracking and reporting are managed in CFS, as well as financial analysis, including clinic and provider performance. CFS has budgeted for the addition of an accounting clerk senior to address the increased billing needs of the Lane County Behavioral Health Division and planned expansion of the medication-assisted treatment services. As these divisions have grown, the revenue cycle support has not increased. We are looking to bring the provider to fiscal support staff ratio into closer alignment with industry standards. CFS is funded through service charges to the FQHC. Slide 2. Next slide, please. There we go. As you can see in the graphs, the FQHC provided over 111,000 billed encounters in the current fiscal year. While total FTE count for the division is 14 FTE, only 10 of those staff are dedicated to billing responsibilities, supporting over 140 providers. CFS has completed an evaluation of the next-gen practice management setup with an outside consultant to identify system functionality that can be used to improve efficiency and increase automation. We have begun implementation of the recommendations and expect to continue these enhancements throughout FY 21-22. CFS is managing an increase in reporting and reconciliation requirements due to the capitation agreements with OHA, Trillium Medicaid, and Pacific Source Community Solutions. These plans pay us a flat reimbursement per Medicaid member every month, which helps stabilize revenue and encourage outreach and engagement with the Medicaid population in our community. Moving to this methodology with our Medicaid payers is in alignment with CCO objectives. CFS will also provide reporting for federal funding in response to COVID relief disbursements to the FQHC. And now I will hand over to Ron Jelm with the Community Health Centers.
Thank you, Lisa. Thank you, Chair and Committee. I will say as a comment, Lisa's group just does yeoman's service in not only the volume of work that has increased over the year, but the complexity as we have organized into more complex payment arrangements with insurers, incentive arrangements. It isn't just an increase of volume of service, it's an increase in complexity, and she does and her team just does a great job. So I want to call that out. The Community Health Center, you can see the mission there is to improve the health and wellness of our community through access to affordable, holistic health care. As you may know, we provide service in our community through 6 sites, all in the Eugene-Springfield area, and we're looking to expand. I won't go through the list of the services, really full service, primary care, and integrated service. And we have been expanding the scope of our service, particularly as we have done opioid treatment and pain management over the years, really a nationally recognized program in wellness care. that has added alternative medicine, acupuncture, mindfulness, that has been so important in meeting the needs. And over the last couple of years have added integrated oral health, which has enhanced the care that we provide, particularly for folks with chronic illnesses such as diabetes. I will say that last year, as many areas and particularly many provider organizations, we were hit with COVID. Typically, we see 30 to 31,000 or more individuals in a year. Last year, we were down to 24,000 because of the impact of COVID and the reduction of services. I'll talk a little bit more later about how we continue to expand outreach to reach into the community, but a pretty profound impact in our community. You see our FTE count just a little under 200, couldn't get any closer to 200, with an annual budget now of over $37 million. I will point out to the committee, many of you do know, the community health centers do not receive any general fund. We are all dependent upon, we receive some grants at a federal and a state level, but the vast majority of our funding is a result of our payment arrangements with Medicare, Medicaid, and commercial payers. Next slide, please. Only 2 ads. We were very careful this coming year in budgeted ads, particularly with concerns to revenue losses with the result of COVID impact on our organization. 2 FTEs for the fiscal year. One is a mental health specialist, integrated behavioral health specialist. The second is a medical assistant. The behavioral health specialist cost will be covered through billings and revenue. They're able to generate revenue services. The medical assistant will be added to our pharmacy refill team. Our pharmacy refill team, quite frankly, help manage literally tens of thousands of refills for our patients over the year. And we are able to generate some revenue through our 340B program that's been able to allow us to add not only our pharmacists, but medical assistants for our medical refill team through that program. So those will be covered through revenue increases. As Karen mentioned, we are planning to open a new CHC site in the Cottage Grove to serve the South Lane and North Douglas County areas in spring of 2022. We had hoped and originally planned that would be sometime this calendar year, but that was delayed really due to COVID. And we will adjust our budget and a supplemental as we have a target opening date for that site. Next slide, please. I do want to point out and kudos to Lisa Nichols and our data and quality compliance team. They just provide fabulous service to not just the CHC, but all of the H&HS divisions in reporting. We have active use of a number of clinical and operational dashboards. And I will tell you that is so important because the way we are compensated is changing more and more to value-based pay. That's tying part of our compensation to the quality of the clinical care that we provide and our ability to demonstrate that quality. And so the data dashboards that we use and the Tableau reporting are just so important to be able to monitor things like the A1C, the sugar level, if you will, for patients with diabetes, to be able to track, are we doing those well-child checks on time? Are we managing hypertension? Are we doing all of those clinical metrics that are actually more and more tying to our revenue? We have expanded services this past year. We were on track to add telehealth a year ago before COVID hit in March. Thankfully, we had the platform in place and we were able to pivot very quickly to telehealth services. To your question yesterday, Commissioner Farr, to Pauline about telehealth services, Absolutely, we will continue to use those services. We have found those instrumental, not only in reaching out into the rural areas, but quite frankly, connecting into people right here in town who you know need to take maybe one or a couple buses to get to one of our sites. Doesn't meet all the needs for all the patients all the time, but it's not designed to. It is a tremendous resource enhancer. We have added kiosk check-ins and patient portals. We'll be doing more of that. Thanks, Pat. We'll be doing more of that during the coming year. As I mentioned, the Cottage Grove site, and we're looking to expand to full service dental. Last slide. As I mentioned, big impact with COVID. We closed our Springfield Schools Health Center site at the time that the schools closed. We look to reopen that with the beginning of the next school year. And then we had a whole raft of services that we needed to suspend for a period of time. Most notably, all of our preventive dental services out in the schools and the community, to WIC, to the Head Start, those were put on hold as the schools were closed. Those continue to be on hold, and we are looking forward to being back in the schools with those preventive dental services with the next school year. We implemented telehealth, as I indicated, and boy, a lot of our staff immediately started to work off-site. Fortunately, some of the services, like the pharmacy refill team, did not have an impact on patient care. Of course, many of the services that we provide, you have to have the staff on site. But you know, a good number of our staff were able to immediately pivot to work off-site, and some continue to do that. A significant revenue hit to revenue because of COVID in the neighborhood of $2.5 million. So, you know, we are looking to make that up this coming year, but certainly an impact. And with that, it is my pleasure to turn over the presentation to Carla Tazamal, who is the manager of our Developmental Disability Services.
Okay, thank you, Ron. Hello, everybody. I appreciate the opportunity to share with you information about the Developmental Disability Services Division. This slide provides an overview of the division. It includes the mission of Developmental Disability Services, as well as a photo of a child who receives services from the division. And there is a core list of the services we offer. Those core services include providing eligibility determinations for all individuals in Lane County who are seeking supportive services needed as a result of having an intellectual or developmental disability. In addition to the eligibility determinations, the division staff investigate reports of abuse and neglect of individuals receiving services. And the largest number of staff in the division are dedicated to providing case management to individuals in services of all ages. The services provided through case management are broad, with overall goals of providing person-centered services to support the health, safety, and well-being of individuals, including supporting their integration into the community. In addition, the division is responsible for facilitating the certification, licensing, and employment of over 1,800 providers in the community, such as foster providers and personal support workers. All of the funding for the division is received from the state. There's not a general fund request in this proposed budget. Next slide, please. This slide depicts the growth in services that we've experienced over time. Developmental Disability Services is an entitlement program, meaning everyone determined eligible receives services. Waitlists for services are not allowed, and most of the individuals who enter services remain in services until death. Over the past several years, the number of individuals has steadily increased and continues to grow. This increase has been fueled by the expansion of the in-home supports that have been offered since about 2013. The bottom chart is a projection of future growth for people receiving case management services based on a prior 5-year trend. And the pie chart on the right represents the total individuals open for case management services. Currently, we are serving over 2,800 individuals, including over 1,600 adults and almost 1,200 children. As Karen mentioned, we're currently located in the basement of the Public Services Building. Given the continuing growth in services and needs to improve access for clients, we will be moving to a new building being constructed on the same campus as Youth Services and Lane County Behavioral Health. This will not only accommodate the growth, but allow for coordination of care with the other divisions. The picture of the building on the slide is a depiction of what the building is expected to look like when completed. Of course, we'll be keeping an eye on what is happening with the state budget, but we have been fortunate to maximize our revenue this past year and have healthy reserves. Next slide, please. This final slide is specific to the impacts to the division as a result of the pandemic. Prior to the pandemic, it was the standard for staff to meet with people, including providers and individuals, in person as well as by phone. However, we are required to follow state regulations, which have changed during the pandemic to restrict in-person contact. As a result, services are being provided primarily by phone and virtual meetings. The exceptions include licensing and certifying foster homes, which is done in person starting in March of this year, and some visits with individuals to address urgent health and safety concerns. We have closed our lobby to the public at this time, and we are providing services by appointment only. If you have the opportunity to visit our lobby, you'll find it is very small given the number of people we serve, making it difficult to effectively provide social distancing. Another impact to the division and people served was the rollout of the vaccinations for COVID-19. The state sequencing plan prioritized people with intellectual and developmental disabilities to receive the vaccine. Staff in the division worked closely with public health to ensure people with intellectual and developmental disabilities had the opportunity to receive the vaccine. And this picture on the slide is of 2 staff in the division working at one of the first vaccine clinics. I will now hand it off to Steve Manella, the Human Services Division Manager.
Thank you, Carla. The Human Services Division administers a range of programs that support people in Lane County communities, which include veterans, seniors, adults, children, youth, and families, especially during times of challenge and transition in their lives. The Human Services Division helps address the root causes of poverty, hunger, homelessness through a range of prevention, intervention, stabilization, and economic opportunity services. HSD administers funding, coordinates services, and provides assistance in 5 major program areas. HSD administration provides leadership and oversight in planning, policy grants management, programmatic contract management, budget development, and personnel management and supervision. Our Energy Services Division provides a variety of low-income energy assistance programs, energy education, and weatherization services. Our Human Services and Housing program provides a continuum of care with the goal of moving low-income and homeless people towards housing stability and self-sufficiency. And our Veteran Services provides counseling, advice, and assistance to veterans and their survivors, dependent parents, in order to obtain benefits that are provided by the state and federal government. Finally, our Workforce Services provides a variety of services promoting and fostering employment opportunities for job seekers and workforce development services to local businesses. The division is governed by 2 regional policy boards. One is the Human Services Commission, a 7-member board comprised of Eugene, Springfield, and Lane County elected and appointed officials. And then also the Poverty and Homelessness Board, a 15-member board made up of elected officials, community members, and major public and private agency representatives whose purpose is to reduce poverty and homelessness in the county. Housing and homelessness is done in partnership with the City of Eugene, with private nonprofit organizations, and with our partners at Homes for Good. Currently, the division has, in the proposed budget, has 52 plus FTE and a budget of $31 million. Next slide. This year has been an interesting year for our division. On the next slide, I'll talk about some of the impacts of the COVID epidemic and some of the economic impacts that that's had on our community and the people who live here. During this past year, we've had a number of accomplishments. One of those has been in the area of increasing the availability of permanent supportive housing. The 51-unit Housing First MLK Commons was opened with our partners Homes for Good, a project which the division has worked on for several years with the healthcare sector and others to get up and operating for homeless people. We also have collaborated with Homes for Good on planning services for 3 additional permanent supportive housing projects totaling 97 units to be opened in the next several years. We expanded our coordinated entry and outreach services for homeless individuals. This is an approach that builds on a by name list so that we get to know the people that we're working with and develop the best strategies for assisting them in their situations and to become stably housed. And we began rapid resolution services that were recommended by a study performed by Technical Assistance Collaborative, otherwise known as TAC. Rapid resolution services are intended to be upstream, and the concept there is to work with people before they become homeless at the point that they're considering having to go into emergency shelter or losing their housing. We placed 120 pallet shelters at microsites and rest stops throughout Lane County. One of the things that came out of the pandemic is some great work with our rural communities. We put up pallet shelters in Cottage Grove and in Florence and in Veneta, and established some good relationships with the smaller cities and some of the charitable organizations in those communities. Our Dovetail program continued to provide social services to our customers, many of whom have very significant healthcare needs. Additionally, this year with the pandemic, we began receiving large sums of money for rent assistance and our utility assistance programs. We dispersed in the past year over $8 million of emergency rental assistance to almost 2,000 households. This is an area where our budget expanded. Thus far, we've received about $47 million in state and federal rental assistance, and we will be receiving additional dollars in the months and weeks to come. Our energy services delivered an additional $3 million of COVID-19 energy assistance funds, again, to help people stay in their homes, stay warm, and during the pandemic. A major concern in relationship to the 2 areas that I just spoke of on housing stability is that, for the first time, we not only experienced a pandemic, but also a state and federal moratorium on evictions. So I think in a slide that you saw the other day, and you may see again, first-time homelessness has been reduced because we've been able to keep more households housed. But the thing that we look forward towards is the fact that we have more people who are out in the community who are unsheltered, who are living in tents and in vehicles. And the other phenomenon is that we have this rental moratorium that someday will end. And so we'll have more people, again, who will be in a position of needing to pay back rent if they haven't been able to benefit from our programs. I think Karen mentioned earlier that our workforce division was heavily involved with the Holiday Farm fire. So we have some specific grants that are grants that the intent of the grants are to put people back to work. And I think we'll see more of this with the economic recovery after this COVID recession. Our Veterans Services continues to lead the state in the total amount of VA benefits that we received. In the last fiscal year, we received over $163 million for veterans and their survivors. Our Veteran Services Office continues to outperform larger counties such as Multnomah County in recoveries. Next slide. So many others in our department have talked about the negative impacts on their finances during this period of time. The experience in the Human Services Division has been different. We've been in the position to be a responder and to see significant growth both in our budget and our operation. Again, as I mentioned earlier, a lot of our services are done in partnership with private nonprofit organizations and with public organizations such as Homes for Good and Senior and Disability Services. The division budget increased this current year by 180%, and we continue to receive funding. I think the figures that you have for this budget, you'll see by the time that the Board of Commissioners adopts the budget that there'll be additional federal resources that are coming out of the American Rescue Plan, both from the state and the federal level, that will additionally be added to the budget. So this current fiscal year, we have a budget of over $60 million. To give you some sense of the volume of the work, we've added 51 additional service contracts, and we recruited 7 new nonprofit partners. So, groups like community supported shelters and others that have not traditionally worked with our organization. We've needed to expand the base of nonprofits that we work with in order to expand the services that we're providing. We've added 6.5 FTE, and we have 8 temp positions. Those 8 temp positions are working on a grant program providing outreach to homeless people. We expanded our homeless outreach services to rural Lane County, Oak Ridge, Cottage Grove, Cresswell, Florence, Veneta, Junction City. And the other thing that I wanted to mention that impacts our general fund use is that we end up having more than $250,000 in new overhead that's not covered through the COVID funding. So we received this significant amount of additional federal and state funding to provide services, and that funding, both for our operation and for the nonprofits that we contract with, has insufficient money in order to cover the overhead of moving those resources through. So now I would like to pass the presentation along to Jocelyn Warren, our Public Health Division Manager.
Thank you, Steve. Chair and committee members, thank you for the opportunity to talk about public health. Public health ensures the protections critical to the health of all people in Lane County through surveillance and response to communicable disease risks, as most people are well aware of now. Public health also prevents chronic disease and injury through evidence-based policies and interventions that promote optimal health for all people in Lane County through multi-generational population health programs that serve children and families. Those services are listed here on the slide. I won't go through all of them. I'm sure you're familiar with them. Our FTE represented here, of course, is expanded dramatically with our COVID response. That also includes the resources and expenses that are coming to public health, and which public health are now expending quickly. Let's go to the next slide, please. We're still, of course, very deep in the COVID-19 response that continues to dominate our services. Our Emergency Operations Center continues to operate, and we are, of course, mostly preoccupied now with responding to the increase in cases as well as delivering vaccine in the community. So that effort occurs on across multiple sites as well as in many areas of our county. We're also doing a lot of outreach and education in order to promote vaccination. Another thing that some of the highlights that we're looking forward to in this next year, expanding the racial equity work beyond COVID-19 is absolutely a priority. It's been a real opportunity for us to engage with our community-based organizations and some of our more rural areas of the county for both COVID-19 testing as well as vaccination. So we plan to continue those relationships and be able to use those and to co-create strategies with our community members to address other areas of health impact in the community. So that piece is really exciting. We're also planning, of course, for staff reentry at some point. We're still not sure what that's going to look like. Most of our staff in the maternal child health program and in WIC and in environmental health have not been in the building. So this building is full to bursting, but these are not the staff that were here in January of 2020. These are a whole different response crew here now, which has been really great. We've actually hired a lot of temp and extra help people. We also have been using a lot of staff from across the county. So when Karen talks about integration, our Emergency Operations Center has been a really terrific example of a lot of people pitching in for this pandemic response. Finally, one other thing I wanted to highlight too is expanding sexual health services in response to community need. We'll be reporting more on this to the Board of Health soon, but we have seen a real uptick in sexually transmitted diseases in Lane County and in Oregon, including congenital syphilis, which is a real failure of the public health system and something we really need to put some real effort around. We're going to both be expanding our clinical services as well as our collaborations with community partners and putting more work into prevention. Next slide, please. So to highlight a little bit the pandemic impacts, as Steve Manella mentioned in the Human Services Division, it's mostly increased our budget dramatically. There is a great deal of resources coming to public health to improve testing and case investigation and contact tracing and increase lab capacity and to do vaccination clinics. We've also, though, experienced, of course, some of the very, very similar pandemic impacts in our services that were pre-COVID, including environmental health due to low food handler card fees, as well as restaurant licenses. Those have declined significantly. We expect that those will increase again during recovery. There's also declining WIC and our nurse home visitor caseload. The budgets that we receive for WIC depends on the caseload of people that are carried. A decline in caseload means a decline in funding. And we also have, our WIC is also the largest referral source for our home visiting programs. So as those WIC numbers declined, so do our opportunities for home visiting. So we also had the increased expenses we saw with COVID, of course, were around extra help and temp staff, 106, which is more than all of our public health staff combined initially. So it's more than doubled our staff. We have also partnered with a lot of community organizations to help deliver these services, and those have totaled $3.6 million. And we are also, of course, all the expenses we have in delivering mass vaccine clinics across the county. We have 3 sites. We're able to stand up all 3 when there is the need and the vaccine. So those are really major and resource intensive events. And that's been, so there's been a lot of expense, of course, associated with those. The other impacts, of course, that are really important to highlight are public health staff burnout, for one. We've had people working in the EOC since the beginning who have, it's been a lot. There's been a lot of work. It's gone, up and down and up and down. And certainly in the beginning, we had no expectation that this would still be something that we would be doing in May of 2021. And of course, the end is not yet in sight, and we still have a lot of work to do to get vaccine out. We have made some adjustments over time and how the EOC works that have been really successful. But we also have a lot of staff that I think are just, even if they're not working directly in the EOC, and I'm sure that everybody has seen this across their divisions, it's exhausting being an emergency response for a year and a half. So everybody is feeling that, and we're doing what we can to try to keep up morale, including today, which is National Nurses Day. So we took special pains to make sure our nurses feel appreciated and know that we recognize the incredible efforts that they've put forward this pandemic. And including, we have 3 really terrific nurse supervisors in public health that I would like to hold up. Chelsea Whitney, Paula Tomzak, and Sarah Kuyenga, who the last two of whom are our new communicable disease supervisors, which is very exciting. And then we have done mostly our normal business and practices, as I mentioned, such as WIC and home visiting, environmental health. But we had a number of initiatives that we had to put on hold that we look forward to picking back up again. That includes the Family Connects universally offered home visiting program, and as well as expanding our sexual health services that I mentioned earlier. We also have a hepatitis A prevention initiative, especially with the unhoused, that we look forward to picking up again. And also just general public health work and engagement in a number of related issues that we don't lead, but feel it's really important for public health to have a role in. And those include the County Climate Action Program, the Early Learning Alliance, and the Public Safety Coordinating Council, for example. Okay, that's my presentation, and now I'm going to hand it off to Lisa Nichols, who is the Quality and Compliance Manager. Thank you.
Thank you, Jocelyn, and good afternoon, Budget Chair and Budget Committee. The Quality and Compliance Division serves to meet important and growing needs across the H&HS department, including the areas of data and analytics, compliance, electronic health record support, and quality improvement. For the work in compliance, it is our task to complete department level work to ensure adherence to regulatory requirements. Examples of this include oversight of HIPAA privacy rules, risk management activities, and maintaining the formal compliance program and its associated elements. This team also works with each division to meet their individual compliance needs, such as providing support for external audits and providing guidance on rules and regulations. Over the past year, the team has focused on continuing risk management activities for H&HS divisions and programs, formulating policies and procedures, and assisting H&HS in navigating the rule adjustments that have occurred in this new landscape. For our EHR team, this team works to provide day-to-day support and training to staff utilizing NextGen, our electronic health record platform used by the CHC, behavioral health, the methadone treatment program, maternal child health, and clinical financial services. This work includes responding to staff questions, training new staff, updating and creating new templates to support optimal workflows, and overseeing system updates and upgrades. A great example of an update that occurred in this last year was very quickly reconfiguring the system to allow for telehealth services, such as spoken to by Pauline yesterday and Ron today. That was a great transition that has led to a new workflow that we will maintain for time to come and will really benefit the community that we serve. So really proud of the team for doing that. As you can imagine, this work is very essential to support the work of our direct service divisions, and it keeps this team very busy. Good examples of this in the last calendar year, we have one team trainer, and she provided 359 trainings to 187 end users, and the team as a whole resolved over 4,300 support ticket requests. It's a lot. In the area of quality improvement, we support both department and division work related to our goal of continuous improvement. Examples of this include mapping processes, providing guidance on change management principles, and of course, planning and implementing improvement projects. The work of this past year has focused on department equity work and planning for a strong presence in projects related to the new H&HS strategic plan. Next slide, please. This slide represents the COVID-related work completed by our data and analytics team in conjunction with public health. This picture is the table of contents for the visualizations created to inform both our staff and our community on the COVID efforts. In total, 36 dashboards have been developed that have been viewed approximately 1 million times by staff and community members. To be honest, I was going through these dashboards trying to pick just one to represent on this slide, and I couldn't decide on one. All of this work has been so instrumental in assisting with these efforts, and I'm just so really very proud of this small 5-person team, but very mighty. I could go on and on about the work that they do, but I know you don't want to listen to that. So I will just close by saying that this team works miracles, taking data and transforming it into information that can be used to drive service improvements and inform and assist with decision making. Thank you, and I will now turn it over to Katrina.
Good afternoon. I'm going to start by highlighting a few of our accomplishments. It sure is hard to just pick a few, given our really phenomenal team. You can see a few pictures here of our mass vaccine clinics, and that's just a wonderful example of partnership. Well, first I will say public health leadership, partnership across the department, across the county, and across our community. We have just had phenomenal partners and volunteers step up. We've provided more than $8.5 million in rental assistance paid to our community members. We've supported 147 community job placements and 47 on-the-job training opportunities. And our federally qualified health clinics have provided over 60,000 virtual visits, or sorry, over 57,000, almost 60,000 virtual visits. So quite impressive. You've heard a little bit about our new MLK Commons, our permanent supportive housing, and you can see a picture on the bottom left of that. We're so pleased to have that in our community and more to come, as you heard from Steve. And then I want to just take a second to lift up the wonderful work of quality and compliance. They have provided almost 3,000 dashboards and visualizations. This is not only essential to our day-to-day operations at Health and Human Services, but it has been so critical and helpful in our emergency response for both COVID and fire. Next slide, please. So as we look forward, there are, yes, challenges and a lot of opportunity. We are still continuing to respond to COVID, of course, and are also looking towards that recovery piece. But we know at Health and Human Services, our services are going to be more important than ever. And we are prepared to do that and will do that, but that is a big lift for us. Our continued investment in homelessness and permanent supportive housing, expanded mobile outreach services, particularly to our rural communities. We know it's our job and imperative that we get out to our rural communities. Thinking a little bit about our infrastructure, we are a department that grows and meets the community need, and we're really aware that in order to keep meeting that community need, we also have to take care of our infrastructure so that we can do that. So that is front of mind for us. And then our people are amazing, and they have been on the front lines of this last year that has been hard for all of us. And so we need to continue to focus on taking care of them and supporting them so they can keep taking care of our community. And then lastly, expanding our equity work. This is critical to us. This is part of our new strategic plan. And that looks like expanded outreach and engagement with our community, looking at our hiring and recruitment strategies, and expanding our data so that we're really using that data to inform our work as we move forward as a department. Next slide, please. And a few of the ways that we are so connected to our Lane County strategic plan under Safe and Healthy Counties, of course, that strong focus on affordable housing and reducing homelessness. We will continue to get a lot of rental assistance out in this coming year. Increasing access to behavioral health and community health. We're thrilled to be able to open a South Lane clinic in the near future. We're working hard on that planning and development, as you heard from Ron. And vibrant communities. So really looking at that resilient and diverse, sustainable economy. So continued workforce development. And equity. We've talked a lot about equity, but that is core for us, and we will continue to make a lot of effort focused on strengthening our community relationships and our advisory boards. Our robust infrastructure. As we grow, our buildings have to grow, right? So we can take care of those people and people in our community. And one of those examples is the River Avenue purchase, which has really been huge to support our COVID response. And we can't wait for the day until we can turn that into a navigation center and help support our unhoused communities. Our people and our partnerships, again, we need to be paying close attention to our employee engagement and our resiliency, and our enhanced partnerships. We're learning a lot in COVID. We're building relationships, we're strengthening relationships with communities and organizations, and we look forward to continuing to do that in the coming year. Next slide. We looked at this yesterday, but I'll highlight it briefly. These are just two of the ways that we're measuring performance, and this is, again, is really focused on the integrated support for those at the intersection of behavioral health, homelessness, and public safety. That first measure, reducing the incidence of first-time homelessness, is taken from our HMIS system. And then the second measure, looking at reduced utilization of emergency room and public safety by people that have more than one behavioral health condition. And again, we know this year has been impacted on many ways by many things: COVID, economy, and racial justice. And I will, next slide actually, we'd like to open it up for questions now. Thank you.
Thank you. Questions from committee members? Commissioner Farr.
Thank you, Chair Lodman. I have a lot of questions, but in the interest of time, I will not ask all of them. My first one, well, first, congratulations to Carla Tazamel. I've been asking you for quite some time now, how are we with the progress on the new DD building? And at the Mental Health Advisory Committee, you give us an update. And for a long time, it was, well, it's coming, it's coming, it's coming. And now you're saying it's nearly here. I love to hear that. I'm looking forward to my old armory building being repurposed for very deep impact in the community. My question is really a general one for Steve Manella, Ms. Gaffney, and that is our Human Services Department has a reputation for being able to be prepared to accept money outside of the regular budget process and utilize it immediately because of projects that are ready to go, because of staff that's ready to hit the ground running. And I cite examples which were multi-departmental of the Red Lion facility that we repurposed for ultimately it's going to be at some point in the future permanent supportive housing. Also the River Avenue facility, which we acquired, and it's going to be a multi-use facility for a while that will be with us for generations. But Steve Manella, you talked about the pallet program. Now we're all interested in the pallet shelters. That came outside of the regular budget process. How did that money come to Human Services, and how were we able to use it as quickly and efficiently as we did? Can you talk about that? And you don't need to spend a lot of time, but it's very impressive that we got that on the ground as quickly.
Yeah, that's an example where the state legislature gave us additional money called out of the coal money, and we were able to use that money in order to purchase those pallet shelter units and provide services.
And if I can just add a little bit to that, Commissioner Farr, I think it is a great example of this last year and a half now, where we've been looking for those opportunities in the crisis to be able to leverage different things. And I know that you all have been tracking on the different waves of dollars. Last year we had CARES Act money that came through to the counties. And really, as we look at projects like the pallet shelters, we know that we need the one-time capital money, and then we also need services in order to be able to support people to be able to, I'm looking for the word, to really be able to sustain and thrive in those settings. And so we were able to use the capital money that comes out of the CARES Act with the services dollars that came down through the state, and be able to weave those together to very quickly mobilize to support people in the community. So thank you for lifting that up, Commissioner Farr.
Thank you, Director Gaffney and Steve. Very briefly, Chair Development, I'm listening to Steve Allen in this earphone right here, making a presentation on some of the things that we're talking about at the state level. But I hear other counties struggling with their ability to take the money and use the money immediately. That's something, Ms. Gaffney, that you don't seem to have a problem with. Congratulations on getting money directly into the community, even outside of the regular budget process.
Other questions from committee members? Commissioner Trigger.
Thank you, Chair. Thank you for this presentation. Really appreciate it all. Can you share, whoever's, I don't know if it's Ms. Gaffney, a little more? I'm concerned when I see about declining WIC caseloads and about reducing service levels in that program. As many of you know, as a former WIC mom, it's near and dear to me. And if the declining caseload, it just seems like one of those sort of self-fulfilling prophecies, right? If the caseloads are down, then we get less money. If we get less money, we can't keep the program going. So the particular ones related to COVID, those are clearly temporary, and those caseloads will come back up. So I'm concerned if we cut capacity, we won't then be able to meet as caseloads come back up, and wonder if there isn't some kind of waiver or dispensation to account for that service gap specifically related to COVID. But I also noted that some of the challenges with funding that program ongoing might be because of the state budget not including the resources that we need. And you mentioned the funding level that you've included here serves 7,068 clients a month, which is the state assigned caseload. But what's the gap between the state assigned caseload and the actual community need? Because to me, this is one of those classic ounce of prevention being worth a pound of cure programs.
Yes. Thank you, Commissioner Trigger. And I'm going to briefly start, and then I'm going to toss it over to Jocelyn. I am not surprised that caught your attention. I know about your passion for the WIC program, and truly I'm going to go out on a limb, and Jocelyn can correct me, but I would say it is the most well-researched long-term prevention program that we have in this country, and the results from WIC are really quite tremendous, and a piece of why we have really advocated to creatively make sure we can support that as funding has changed over the years. So Jocelyn, you want to talk a little bit more? It's been yeoman's work this year to have WIC reaching the people it needs to reach.
Yes, thank you. And thank you, Commissioner Trigger. We're also a little bit concerned. I absolutely agree about that self-fulfilling prophecy and that cycle that happens if you lose capacity. Then it makes it very difficult to provide the service that you know is needed in the community. And I would say what the gap would be typically whatever, like during regular times, I think we're in about the 91, 92 percentile. So that additional piece would be the gap. That's much larger now. I don't believe there's been any talk at the state, or there may have been talk, but there certainly hasn't been any decisions about making accommodations for lower case rates at this point. That may come as things become clearer and as the National WIC office makes additional adjustments. I think one thing we could do a lot better is partnering, especially now things are starting to open up a little bit more. We still can't do in-person services, but we could do better partnerships with our CCO partners, for example, in making sure that people know that WIC services are available. These are not services that will be impacted by any of our eligibility won't be impacted by the anti-poverty programs that are available in the American Rescue Plan, which is good news. These will still be available, and nothing in there would disqualify people from also participating in WIC. So we certainly intend to make that available and hope that families continue to avail themselves of the opportunity. At first, people were really excited about online and not having to come in for classes, but I think that's starting to wane now. So that education piece is really still so fundamental to the WIC experience and to the ability to have that opportunity to provide that education. So we're looking forward to being able to do more of that in person.
Great, thanks. Yeah, and I will just say, yes, the education piece, but the in-person was like, sometimes it was the only other adult you spoke to in the day was your WIC appointment. So, so yeah, the in-person, that human touch is really important.
Other questions from committee members? Okay. Looks like we're good to go. Thank you, Ms. Gaffney, and the rest of your team.
Thank you very much.
Thank you. Okay. We're running a little bit ahead of schedule. I would like to go ahead and take a short break in the meeting. Let's see. Let's reconvene. Let's reconvene at 3:20. If you would join a couple minutes before that. So go ahead and take a break, and I'd like to kick off our next group at 3:20. Thank you. Next section, the update for county administration. Mr. Mokrowski or Mr. Rickoff, please take it away.
Thank you, Chair. I will start, and then Mr. Rickoff and Ms. Williams will, the three of us are going to share the presentation here today. So county administration, and we'll walk through various elements for you. This is the team that I lead, along with Greg and Judy and a number of other managers and supervisors that we have here today. This team is really focused in county administration on strategic and organizational leadership for the entire organization. So you've heard already yesterday and today from our direct service departments, and our focus in county administration really is to provide that strategic and organizational support and leadership for the entire organization, to our departments, to the Board of Commissioners, and the staff throughout the organization. There's really, I just want to start by saying it's been a remarkable year, and I know that's a theme that we hear from everybody. I've been really proud of our entire organization, in particular our county administration team, that when things like a global pandemic or a wildfire or these major crises happen, it is the folks from county administration that it becomes sort of an all hands on deck focus. And we have had just countless individuals who, while it's not in their job description, have served in the Emergency Operations Center for COVID, gone over and served in the Emergency Operations Center in the wildfires. Austin Ramirez was one of the awardees from the LCOG annual awards for his incredible work that he did in the COVID EOC, and then ran over and helped out on the wildfire EOC. And we just have so many people who have done that type of work. You'll hear examples about the purchase of the Red Lion and the incredible work by Jeff Kincaid and folks on that, the former VA clinic, and those things where we're able to move really quickly, flexibly, creatively to get things done. It's really been in large part the incredible work of our team in county administration. So innovation and creativity is what this group brings to the table. In addition to their day-to-day work, it's really that thought leadership, innovation, and creativity to solve challenges. So I'm going to turn it over to Judy. That just sets the stage. Judy will walk through sort of the organizational structure, the budget, and then we each will share portions of this.
Thank you, Steve. Good afternoon, Chair Vlodman, Budget Committee members. Thank you all for being here and paying attention. Welcome to Bruce and Chris. Thank you for being on this committee. Judy Williams here. I'm the Strategy and Integration Manager, as Steve mentioned, and I have the privilege of walking through a couple of slides, just kind of highlighting the department overview, talking a little bit about budget as well, and then turn it back over to Steve and Greg as well. And then before we kind of get in too deep, Steve mentioned it too, and I just want to, while this is a budget meeting, again, highlight the incredible work of staff. Each and every individual in our department, I could go on and on, but with each and every one of you, as Steve said, it has been a year, but I think even in a boring, non-crisis year, we have staff that just not just deliver service and do the work, move on to the next thing, but really bring that professionalism, have that top-notch level of service, be passionate, authentic, and really helping each other out handle the things. And so again, with this year, it's just been remarkable to be able to work alongside such an amazing team of individuals that really upped their game, another 100% to really tackle the crises at hand while also maintaining keeping the lights on, having business run, and so on. So I know this is a budget meeting, and I'll try and get to the specifics of a budget, but it just truly, again, couldn't happen without the people and the people that we have. And so with that, county administration, so this is our department presentation. You did hear from Pro and Probation yesterday. We also have two other divisions, so our county management division and operations, and both Steve and Greg will go into that a little bit further. Our mission is really, we responsibly manage available resources to deliver vital community-centered services with passion, drive, and focus. So as mentioned, with this being a budget committee, I'll get to some of the specifics of the budget. So I know this slide is always hard to read, the pie chart, but you can see that the resources going into our department are vast. We have a number of avenues and ways that we get resources in. So for county management, that division, it's primarily countywide and direct. We also have video lottery funds coming in, other state revenue, court fees as well, that really handles our law library program. In operations, similar countywide indirect, recording fees and depreciation charges. And then just to quickly note, trying to mention what are some of the programs that might get direct general fund transfers, and that is our housing strategies program. So that program that we have a joint partnership with the city of Eugene, as well as the county, and this joint effort to really address homelessness in all aspects of that. So this is that direct transfer coming from the general fund that matches the other $87,500 from the city of Eugene. And quickly on the expenditure side, because we're really combined with this presentation with operations, county management, and all of the programs within it. You can see the capital expenses make up a huge portion of expenses with over 19 million in capital expenses, personnel just under that, and material and services. And we wanted to quickly highlight a couple of new positions, so it didn't get buried in your budget, but just wanted to quickly take a moment to recognize and highlight and explain what we're adding in this proposed budget. So briefly, you heard from Steve in the budget message a couple of evenings ago about the equity manager position and the crucial need for this role. Just super briefly, we've made a great stride and effort in having focused strategic efforts around equity, and we really are kind of at that point in order to move forward and really get at the crucial things that we really need to tackle as an organization and as a community. We really do see that we're limited right now in that kind of depth and breadth of that role. And so we really see this as a great move forward in order to really address the crucial equity work that we have front and center. The other position that's being proposed is a half-time library assistant. Years ago, the library program had more than one FTE, it's at one FTE currently. And this is, there's been a large amount of reserve that this program has built up and really kind of struggled with, do we add, do we not? And this is really just to really meet the demand that we're seeing, and especially in this virtual setting, to really kind of look ahead and see how we could develop, expand, and do things differently in the future. The records clerk is another addition. I think just to highlight super briefly, in our area in terms of records, this is one of the lowest staffed in terms of FTE related to the volume of registrations and the number of recorded documents. And so really hoping that this is the FTE that will help manage that and also be able to help us accomplish this, as well as an election senior admin analyst. Also will greatly help supporting all of the staff in being able to tackle those recorded documents and the increase that we're seeing, as well as providing that support to staff as well. And then finally, a few positions in facilities, maintenance specialist 1, maintenance specialist 2, and a custodian. And this is really in response to a few things. I think, we've had an audit in, a couple of years ago that really tried to drill down on, what are the needs, what are we seeing in the future? And as you've heard with some of the other presentations and acknowledging the expansions that we have, the increased amount of footprint that Lane County has seen a growth in is, it's just crucial that we have and take the time and energy to take care of the assets that we have and maintain, clean, and so forth in terms of maintaining those assets. And just as crucial as financial stewardship is, really taking the time to maintain those ahead of time pays off dividends in the long term. And then just another note, we also moved property management, which has been typically a program within Public Works, to maintain properties, whether they're coming in from foreclosures and other avenues, and moving that into our facilities and capital planning program to really have strategic, thoughtful conversations around the property that we have and making the best decision moving forward. And I'll take a quick pause here, and I just want to make sure, Steve and Greg, if you wanted to add anything in particular to some of these new positions that I either didn't capture, if you wanted to add more.
I think we'll go into a little bit more detail when we have the division managers talk about their assignments. So I think good coverage.
All right. So with that, I will turn it over to you, Greg.
All right. Chair Vlodman, committee members, Greg Rickoff, Director of Operations, COVID-19 pandemic impacts. Really the question is, what didn't we do during this past 14 months? The first line there, employees continue to respond in recovery mode while juggling the regular workloads, is absolutely true. Each and every one was a utility player, from the county administrator's financial leadership team, which is comprised of the budget manager, the financial services manager, and the director of operations to help with the larger strategic thinking, to a great deal of the oversight for the auditing of the funding. You heard from other departments that talked about how they increased resources dramatically during COVID. That is not true for this team. We were doing it with the resources we currently had. And with everyone a utility player, you've seen the legislative agility, the real estate purchases that occurred. The purchases helped other departments, outward facing departments, but a lot of that work occurred here at home and CAO. The equity work that followed the murder of George Floyd, that work occurred here. Down to and including details like in a day's time, making the Wheeler Pavilion and Harris Hall functional courtrooms for the circuit courts. The creativity that this group brought really was pretty amazing. And of course, Steve singled out Austin Ramirez. I'm going to do that too. We led the state in getting money into the hands of businesses impacted by COVID. We've had help since then from the federal government and from the state, but we were willing and able to jumpstart that effort, in large part thanks to the agility and creativity of the team. Let's go ahead and move to the next slide. And after the pandemic came the fire. Not only were we impacted by the fire, we also staffed the fire response. Again, you think of the work of Devin Ashbridge, who was so instrumental in supporting Jason Davis with communications around COVID, then jumping in and serving as the lead on the fire response, and how critical those communication elements were there. One of the ads we've talked about is an ad to the Community and Economic Development Program. We added Laurel O'Rourke to help support the long-term recovery efforts. She's been a remarkable resource to those doing the work up in the Valley. Again, we had the same team of one who really helped with the purchase of 100 River Ave. And Jeff Kincaid, we had him pivot and help us purchase the Red Line. A big thank you to the board chair, Joe Burney, for helping to start that deal. But the nuts and bolts and daily carrying of closing a real estate deal was really a pretty remarkable team with a great deal of work from Steve Manella, but the day in and day out work was done by Jeff Kincaid in the shop. Lots of the financial services and the accounting, again, occurred here. The one piece that isn't here with either of these two emergencies really is that third emergency, the death of George Floyd. It really led to considerable reflection, significant work by the Board of County Commissioners to make clear the values of the community, but it launched an ongoing work in addressing equity and racism in our community, and it's led to a fair amount of policy review, procedure reviews, and the creation of an equity lens that you've heard throughout this process. A huge proportion of that work is led by Judy Williams and by Mo Young, in the shop. Again, utility players with full-time jobs, responding to the pandemic, responding to the fire, doing their day jobs, and also helping with the equity work. So it's really been the curse of living in interesting times. I couldn't be more proud of the colleagues I work with. Steve, I think you have the next slide.
So I think the main point I want to make here is you see the different service areas. A lot of areas covered here in county management. The simple truth is, well, there are a lot of areas covered. We have about 21 people to do that work. So it's a lot of, single, one individual covering these areas. So if you, in very small shops. And so, again, what we're doing is trying to provide strategic and organizational leadership. And then we have these crises that happen and we end up leveraging these individuals to go help with that. And oftentimes we only have, if you look at administration with board support, our equity and access area, the disaster case navigation, which is a new function that we've brought over, intergovernmental relations, our housing strategies, public information, strategic planning, all of those areas are just one person that's leading that. In equity and access, we are proposing the addition of one management position there. We're excited about enhanced strategic leadership in that area. So a lot of work, a handful of folks who are doing that work. The focus going forward, and I think I'll touch on this in the wrap up as well, but in the next year, really, it will be the American Rescue Plan, focused on the American Rescue Plan, coordination and leadership, recovery from COVID-19 as we move into, sort of transition from the aggressive response to the pandemic into a recovery phase, and then continued recovery, support for recovery of wildfire survivors. In addition to continue to roll out our equity lens and the great work that's happening at shelter and housing coordination. We can go to the next slide. A few outcomes that I think you all are familiar with, that we've talked some about. The small business grants, Greg touched on this, that Lane County brought Springfield and Eugene to the table early on in March, towards the end of March, before the Federal CARES Act was approved, and we put out a small amount of money, but local dollars that was really critical in those early stages of the pandemic. And we've continued now to be up to $7 million that we will deliver to our local businesses that have been struggling. Additional funding that we've made available for childcare providers, all of the work and support that we continue to do around vaccinations. Talked a little bit, I mentioned the facility acquisition. You see the picture in the middle there with a number of I think we have a couple of commissioners there, state legislators and federal representatives. Just an incredible quick lift on the acquisition and renovation of the 100 River Avenue facility that is serving currently as a COVID-19 recovery center. And then our goal is to transition that into a low barrier shelter and navigation center after the pandemic. But great work by our team, Jeff Kincaid and others in county administration to get that work done. In addition to the red line, we've talked about Project Turnkey and the quick work on jumping on those state funds and acquiring that facility. And I think I mentioned in the opening on Tuesday that we have approximately 96 individuals, including 30 children with families who are currently being sheltered at the former Red Lion facility. And then all of our work in the adoption of our Affordable Housing Action Plan, which was really great work in partnership with Better Housing Together, and obviously the ongoing need to implement that plan along with our city partners. All of our racial equity work, which continues, but there's been really great progress on that front. And then the workforce planning and the transition that we continue to lead in partnership with all of our departments to make sure that our employees, that we're being flexible and accommodating in every way possible for our employees in the different situations that they come to their employment in, that everyone has, all of our employees have faced different challenges as a result of this pandemic. And we have really tried to recognize those diverse challenges that everyone faces and try not to set policies and practices and procedures in this last 14 months that are just black and white, but really try to instill a lens of listening and understanding and truly equity in how we treat our employees throughout these challenging times. So Greg, I'll turn it back to you.
All right. Now, please understand that operations, although it is fiscally tied to the county administration, that in a managerial sense, it is a standalone department and serves with actually 4 divisions within that unit: parole and probation that you heard from yesterday, and then financial services, facilities, and the county clerk's function. There's 70 individuals in these 3 divisions, the 3 divisions you're going to hear from today. Facilities being the newest division. It was a fairly recent add. You saw that occur in the last budget cycle. I am thrilled to introduce in a moment Sean Waite, who is the division manager in that unit. And she's going to talk a little bit about the facilities audit that occurred in 2019 and the fact that we are covering a great deal of real estate with that team. We'll also talk a little bit about what we've been doing to manage the largest elections in Lane County history in times of COVID, as well as what we've done to manage and continue to audit and review all of the funds during this pandemic. Next slide. I'd like to introduce to you our county clerk, Cheryl Betchart, our facilities manager, Sean Waite, and our financial services manager, Robert Tintle. I have them have a chance to talk a little bit about their programs. Cheryl, why don't you go first?
Great, thank you, Greg. Welcome, everybody. I'm excited to share just a little bit of information about the County Clerk Division. Just in case you're not aware, our main responsibilities in this division are to process voter registration, conduct elections, we record land documents, issue marriage licenses. We have the citizen-appointed board that hears the property tax appeals, and we also manage the county archives. So all of our services are mandated essential services. They have continued throughout the pandemic while we have been closed to walk-in customers. So that in itself, being able to meet all of our statutory requirements is, I have considered a tremendous accomplishment. And I do this with a staff of 14, so 13 plus myself. We recently added 2 positions, which I'll discuss again here in a moment, but we have 6.5 full-time staff at Deeds and Records, and we have 7.5 staff for elections. We also hire 100 to 150 extra help paid workers that help us conduct the elections during those up to four times during the year. So we can't do this work without a team. And I'm very proud of what we've been accomplishing this last year under some really trying conditions. So we're the fourth largest county in Oregon with over 272,000 registered voters and recording over 78,000 documents in the year. So it's quite a bit of volume that goes through our office. We're involved in a lot of your main events in your life. So registering and voting, getting married, we can issue your license. When you're ready to record, if you're buying a home, we can help you with that as well. So then we have some big roles in some key life events for individuals. So all of our election full-time staff have worked on site throughout the pandemic as we are deemed essential workers, and our deeds and records staff as well. We've had 1 or 2 clerks from deeds and records that have been able to work remote, and we put that in place over a year ago. So we are still closed to the public with the exception of some key days that lead up to elections where we do open up to the public. But again, all of the essential services have been able to be provided to our citizens. So in this past summer, the elections building had some security improvements. We had 2 assessments statewide, and with that, we were able to make some considerable enhancements to our building. We also made some improvements due to the COVID restrictions. And so now we have cubicles, and we did as much as we could this summer with the budget that we had and some grant money received and approved money from the county commissioners so that we could make those changes, keep our workers safe, and still conduct the required work that we're mandated to do. I'm happy that elections successfully conducted the primary and general election last year while being closed for the majority of the time, and when the majority of our extra help chose not to work because they had safety concerns. So we were able to continue to work uninterrupted, and we were able to meet all of our requirements. So that is a really, as I mentioned, I probably will say it more than once again, that it was quite an accomplishment for us. Due to the COVID restrictions, and since we have been closed to the public, the staff at Deeds and Records were incredibly creative so that we could provide research requests to our customers. Normally, this would be a process that's by paper. They'd mail in or they'd drop in and they'd request, a copy of a deed or some sort of transactional information. And we could provide it, or they could do the research themselves. We implemented a change early on in March where we were able to take payment over the phone and able to give them whatever information they needed within minutes. That has been very well received by our customers, and we expect it to continue when we do open up to the public, and hopefully that will be soon. In addition, we were able to add 2 positions that Judy and I think Greg mentioned as well. One is a clerk in Deeds and Records, and that primarily is because we have such a high volume and we have been understaffed for a number of years. So that clerk position has recently been added, and we hope will continue in the budget cycle. In addition, we've added a senior administrative analyst position to elections, and they will also be in charge of some key projects and work that has recently been conducted by 2 full-time staff that have been retired for over 5 years and really want to officially retire. So instead of coming in intermittently, we are turning those responsibilities over to the full-time staff where they really need to be conducted, just for consistency of our operation. So that will take care of hopefully our immediate staffing needs in light of the high registration that we do have in the county and the number of recorded documents that has continued to increase.
Cheryl, I'm going to go ahead and cut you off there just so we have a chance for everybody. Sorry.
And that was my last item. So thank you for your time.
Hey, Sean, can you jump in and talk a little bit about facilities?
Absolutely. Good afternoon, Chair, committee members. Sean Waite, and the Facilities and Capital Planning Manager for the county. We are very excited about the direction that Facilities and Capital Planning Division is moving. As you can see in the picture in the upper right-hand side, capital planning hosted a groundbreaking ceremony for the Developmental Disability Services Building, which Health and Human Services discussed in their presentation earlier today. This was just one of several capital projects that we're currently working on. Additionally, as Commissioner Burney stated a couple of days ago, we have implemented the community benefits bidding process that requires contractors bidding on capital building projects of $1 million and over to offer employer-paid full family health coverage, pay a living wage, and have a state-approved registered apprenticeship program. The Developmental Disability Services Building and the renovation to the new Parole and Probation Building are the first two projects that have applied this program to. This program is changing the culture in the construction industry, and we're very excited. In addition, in 2019, there was a facilities performance audit completed. There were several findings identified and recommendations made in areas for significant improvement. The audit identified that Lane County is significantly understaffed in maintenance and custodial positions compared to our peers by approximately 25%. 3 new positions were approved in fiscal year 21 to assist in that deficit. However, in this current fiscal year, we have added an additional 28,000 square feet in buildings to clean and maintain, and we will be adding another 50,000 square feet of cleaning and maintaining of buildings next fiscal year. So this adding the positions in this fiscal year's budget that we requested is not gonna level the deficit. We're continually getting worse with the increasing square footage. So that's something to note as we move forward, talking about adding square footage, to think about the operational costs as well. So additionally, based on the information from the audit, we are putting tools in place to provide better customer service to Lane County employees and to the community we serve. Some of the activities that we have worked on this past year, which we anticipate to fully implement next fiscal year, include the overall organizational changes. Becoming a more centralized service will provide a more strategic engagement approach in how we manage and use county buildings and properties. So combining capital planning, facilities, and property management into one division will enhance the communication across the teams and provide better resource deployment and support our buildings, properties, and projects better. A service level agreement for facility service section has been drafted. The document outlines what services are performed by custodial, maintenance, and landscaping sections. It categorizes emergency response situation and times, and when departments should contact facilities for consulting services. This document will be the foundation for the development of a communication plan and also for key performance indicators. We are refining the CIP process to establish a project prioritization model for capital projects to ensure equity across department when prioritizing work. And this will better manage capital funds, which is in alignment with the Commissioner's strategic plan initiative of a robust infrastructure. We also were very, very busy with COVID-19. We assisted departments across the county by organizing high-touch cleaning for all of our county buildings, distributing masks to employees, and providing disposable masks for clients and customers that came into our buildings. We distributed sanitizer, face shields, and other disinfectant supplies to departments. We changed all filters in the building to a higher MERV rating and adjusted our preventative maintenance schedule to have a more frequent filter change out. And we worked with contractors to get plexiglass shields in place for our courts and departments as requested. We also, as I said, we're looking at data-driven decisions. So one of the tools that we are using is a facility condition assessment that was done in 2019. We are using this document to help us assess the useful life of our assets and prioritizing our capital projects and deferred maintenance projects off that assessment. We are also using our work order system in a more robust manner to measure the number of work orders that are completed within a timely manner, the type of work orders that we're receiving, and also the preventative maintenance is being monitored through that work order system to make sure that we are performing preventative maintenance on all of our buildings in a timely manner.
Sean, I'm gonna cut you off here in a minute.
Okay, I just have one more sentence. The division has come a long way in this last year, and we're very excited for this next year and to continue the work that will serve not only the county employees, but also the community we serve. Thank you very much.
Robert Tintle.
Good afternoon. Thank you, Chair Vlodman and Budget Committee members. So Robert Tintle, Financial Services Manager. So I'll give you a brief overview of what financial services does. We're a small team, but we're actually responsible for a lot of services, accounting services that we are required to do. And I'd like to think, and I tell our staff at times, that we do what we do so that everyone in the county can do what they do. We're kind of like the engine, right, that keeps everything going. So financial services, we're responsible for receiving and recording all of the county expenditures, revenues, and authorized payments on a timely basis, and all in accordance with generally accepted accounting principles. And we prepare the comprehensive annual financial report, which is audited by outside independent auditors, CPA firm, every single year. Our work is. Specifically, we manage central payroll, accounts payable, banking and cash and management, investment management, debt management, asset management. We do all the tax distributions to the districts. We prepare the countywide federal and indirect cost plans. We also have purchasing and procurement within financial services, also mail and courier services, the warehouse services, and again, financial reporting of all of the county funds and departments on annually on a budget basis, a GAAP basis, and a full accrual entity-wide basis. So we have to prepare financial reports on 3 different basis there. So also, while some of the counties have a separately elected county treasurer, the financial services manager, my role, also serves as the appointed county treasurer, so which is different for us. So finance, we fill all of these roles and functions with only 16 employees, well below some similar sized organizations. But luckily, we do have a very dedicated and professional staff that really do have a passion to serve and do their job well, and we're able to meet all our deadlines and obligations as well, public procurement laws, and meet all the accounting requirements. We also have been open to during the pandemic, COVID-19, and most of our staff have been working on site. We do have a couple staff that have been working remotely, but a lot of our work's printing checks, printing, payroll, AP, it has to be done in the office. And so we've had staff do that, all with safeguards in place and taking the proper precautions. Also, as mentioned earlier, during the COVID-19 pandemics, we helped audit with the auditing and processing of almost $20 million of the CARES Act funds, coordinating that whole effort there. So we've done a lot in that regard. Statistically, we prepared 45,000 payroll checks. Everybody likes getting paid. 66,000 invoices, 34,000 accounts receivable transactions, 1,000 purchase orders. So just a lot of transactional work that we need to do. But the great thing is the objectives of financial services really are, we're to safeguard the public treasury and property of the county, of the citizens, and to measure and communicate Lane County's financial condition so that it demonstrates our financial accountability and stewardship to our community. And it's also to facilitate decision-making. And, we have some indicators with that, like our bond rating and other things. Our work, as mentioned, is audited annually. And so that helps look at our internal controls and make sure we are in compliance with GAAP and GASB, Governmental Accounting Standards Boards, and in compliance with ORS.
Good. Are we good? All right, super. Turn it over to you, Steve.
All right, Chair Vlodman, we're going to go ahead and wrap up and leave time for your questions. I think the last few slides we've covered most of this. I'll just point out on future challenges, the continued recovery from the wildfire, as well as the pandemic, likely for several years to come. Continued focus on housing, addressing barriers and creative solutions for affordable housing, and reducing the unsheltered population, and then focus on oversight of the American Rescue Plan funds and utilization of that. Our job in the county administration is really to lead and implement the board's strategic plan throughout the organization. So happy to answer questions on that, but we sort of come in contact with all aspects of the strategic plan. And then just on the last two slides related to performance measures, made some comments yesterday in the opening just about really our focus is on identifying and tracking indicators of effectiveness and success, rather than measuring every single thing that we do, given the dynamic nature of our organization and the type of work. We like to maintain that flexibility and nimble, flexible approach. And so we use these indicators here, some of which are identified in the last couple pages, to help us determine, whether or not we are on track with success related to the board's adopted strategic plan. So we'll stop there, and happy to entertain any questions that you have.
Questions from the committee? There we go. Mr. Hazen, please.
I'll yield to Mr. Burney. Go ahead, Joe.
Commissioner Burney, do you have some? There we go.
I have some statements, but I like going second. Ha ha. I yield back to Dan. And then I'll go. Thanks, Chair. Or Chris, excuse me.
Okay. I wasn't sure who Dan was. All right. Mr. Murphy, thank you for the comments about metrics. I was able to listen to the portion of your comments at the beginning of yesterday's meeting before I joined. And I appreciate all of the thought that has clearly gone into the topic of measuring performance by both yourself and many other staff in the departments. I thought it might be helpful at this sort of middle point of the presentation is to just sort of reframe the performance metrics discussion, and I'd be interested in your feedback, Mr. Mukajewski, on just how do we, as citizen committee members, communicate back to our fellow citizens or get sort of a confidence that we're getting more bang for the buck each year from our investment in public services. And I know that's not an easy, it's a very complex question. And second year on the committee, I understand a bit more about the complexities behind asking the question. But nevertheless, I feel like that's something that it's a kind of incumbent upon us as committee members, when approving the budget, to be able to answer that question. So I'm interested in your thoughts on how we would approach that question. How do we figure out, are we getting more bang for our buck?
Yes, Chair, and Mr. Hazen, thanks for the question. I think there are some broader indicators, and we talk about the general public. We, as we've talked about, we have over 1,700 employees and a $700+ million budget, and just almost endless amounts of services. And so, sort of boiling that down, I think there are a few indicators generally. I always look at an organization's bond rating as a reflection of the quality of financial management. That is a third-party objective entity that has every reason to scrutinize and ask questions and challenge the financial quality of an organization. And so we receive those bond ratings, and I think you can track not only the rating, but the comments from the bond rating agencies. That's one broad indicator of financial health, the responsibility of how funds are being managed and invested, on the overall financial stability and fiscal discipline of an organization. I think reading the budget message is a good indicator. Is our budget balanced? Are we hiring? Are we adding positions? Or are we laying people off? Where are we adding? Do we have a strategic plan? Are we focused on key priorities of the community, or are we not? Do we not have a plan and a direction that's clearly identified and communicated? I think you can look at satisfaction surveys, whether that's community satisfaction surveys or workforce satisfaction surveys, as indicators of how are people feeling about their jobs and about the services being provided by the organization. So to me, they're those sort of broad. And then if you want to get into the nitty gritty, we can talk about, as each department is identifying, these sort of measurements or indicators of success and results. And I think those give you some more detailed idea of whether or not we're making progress. But I suppose I could go on and on, but I want to reserve that. Though I guess that's the short answer.
Okay, Commissioner Burney.
Thank you very much. Several preempting points. Chris, Dan Hazen was a counselor at Soquel High School when I taught there from 74 to 78, and I can't get him out of my mind when I see your name. That's who Dan Hazen is. Seriously. Number two, while I think metrics are important, let me give you the perspective of someone who's never been in county government, never sat on a county budget committee, never was aligning myself for what I'm doing now, and I'm loving it. You can't measure passion. You can't measure the degree to which people don't give 40 hours, don't give 60 hours, nobody's counting, they're getting a job done. And when you look at the last year we have had, I want to tell you that, and I've shared this with my appointment to the budget committee, that in business, I would have hired most of these people. It's been phenomenal. The question hasn't been, are we getting the most, to me, my opinion, the question hasn't been, are we getting the most production out of our people? It's how the hell do we keep our people when they're working their asses off like they've been doing? So I'm giving you my personal opinion to that one item. When I'm in, whether it's business or government or wherever, when I'm working with people, I try and get the best out of them. And my kudos to Steve, to Gray, and to his team. I think they're some of the few people that do a better job of that than I did. A couple of points. One is share our question, Cheryl, Cheryl Betcher. By the way, Greg, we did notice that you tried to cut off 2 of the 3 people, and they were both women. So we're going to be watching you. Cheryl, I do have a question for you, and that is, it has surprised me that now 2 off-cycle election years in a row, at the very last second, the Board of Commissioners has been really pressed by some to have voter pamphlets, right, printed and distributed, et cetera. And it always seems to be this real issue. I'm gonna, here's a text I got from one of the candidates, ironically, for the Springfield School District, if I can do it real quick and not waste people's time. And I'll waste people's time. The point was, he's a working guy, and he doesn't have the time to do certain things. And for him, he really feels that not having a voter's pamphlet was put him at a real disadvantage. So I'm going to request, and I don't know the process, Chair, whether I get to do this personally or whether we need to do it as a group, but I would very much like to see in a budget what it would actually take to provide printed, distributed voter pamphlets for all elections, which means including the off-year ones. So I guess that would start in 2023, because I don't like to be caught flat-footed, and I feel like we have been twice. So it'd be really good to know what it would take so that we could respond to that. That's important to me. I don't know where I go with that question, Chair or Steve, but that's something I kind of like to see, because it's responding to a real community need out there.
Sure, I'll take a start on that. I think that as a committee over the years, we've developed kind of a protocol for managing questions and questions like this, and there's distinct validity to it. I think the first step is the determination if it could be done inside the guidelines that we've already set, as far as if that information already exists and all has to be done is pulled together and sent to the committee, and it doesn't take very much time, and that can just happen organically. But as a whole, if that's a large endeavor, then I'd like to hear about that as the chair. We would actually talk about it as a committee about whether we wanted to invest the staff time. So that's—
No, thanks, Chair. I appreciate it. That's what I was asking.
Yes, Commissioner Farr.
Down the road, I would ask, how does that differ from the direction that's already been given to the administrator by the Board of Commissioners?
I don't understand the question at all. Sorry.
Well, we've given direction to the county administrator to return with the information regarding the cost of voters pamphlets from the Board of Commissioners. So I guess.
Oh, I apologize then.
No apology necessary by any means. I mean, it's probably a tandem request.
Mr. Rickoff, did you have a statement?
Yes, just to clarify that this is indeed a work assignment by the board. Commissioner Traeger had raised this earlier and had the head nods, so we are proceeding with this as an official assignment by the board.
Okay, forgive me. Sorry, Chair. Sorry, board group. My one last thing.
Yes, go ahead.
Thank you. And that is, I just also want to call out that both Judy Williams and Sean Waite have been absolutely fantastic, and Sean has been amazing. I want this body to know that Sean, because Greg and Steve have allowed her to, is creating in response to a community outcry to emulate the Lane County community benefit bidding protocol from multiple school districts, cities in Lane County, has created sort of a how-to with documents attached, so that we're also going to see the implications of something that we put in place reach far beyond county government and extend more and more into county residents, county people feeling the impact of a rising tide lifting all boats. And I absolutely have to call that out. Thank you, Chair. I know that I can't quantify it in a budget, but this is a very talented group doing a hell of a lot of work.
Excellent. And I'll get to you in just a second, Mr. Hazen. I'm going to go ahead and make a comment real quick. First of all, I love the cats in the videos, so those are great. A little competition there. But Mr. Mokrowski and Mr. Rickoff and the rest of the team, and this actually probably goes a lot further and deeper into the county organizations, things people we've heard from already and people are going to hear from. But one of the things I would to say is one of the proofs in a metric is the fact that we actually survived this last year and are still in good standings. And I've been on the budget committee long enough to know that if this had happened a number of years back, this county would have been in a financial mess and in disarray. And we all know that that rolls downhill into dissatisfied employees and a lot of other problems. So a huge metric for me is the fact that we did the right things at the right time years ago to position ourselves to be able to handle the unexpected pandemic, an unexpected fire, an unexpected, civil unrest and civil issues that we needed to take care of. And we actually have come out the end and we're still well prepared to move forward. So that's a huge metric for me. And thank you to the folks in this presentation and a lot of the other ones. I know it takes everybody to kind of make it all work. Mr. Hazen, you're up next. Go ahead.
Sure. I just for a clarification with my fellow committee members about the comments that Commissioner Burney made. I recognize absolutely the value of passion and leadership, and both Joe and I have extensive private sector leadership experiences in large organizations, so we're on the same page in that. We joined the budget committee. All of us are on the budget committee. This is about the budget. It's not always fun discussions, but at the end, I think it makes us stronger, and I think it prepares us for those future crises, as Chairman Floatman, you just referred to. I don't think the business of government is going to get easier. And I think one of the reasons we are where we are is because we've experienced some real challenges in this county with evaporating timber revenues and other things, and that has forced us to be resourceful. It's forced us to find community partnerships that have created one of the most fertile sources of innovation and nonprofit work in the country. There's a lot that we can be proud of. I absolutely recognize that. And I'm throwing this challenge at my fellow committee members and Mr. Mokrahajski because I know we're up to it. I know we can do better at communicating about this budget to the general public. And I appreciate, Mr. Mokrahajski, your concise response to my earlier request.
Excellent. Other questions from the committee? Okay. Thank you, Steve. Thank you, Greg. Thank you, Jean. You bet. Let's move forward. Mike, are you online?
I am here, yes.
Excellent. We'll move right forward. Take it away when you're ready.
Great. Thank you today for the time to present the budget committee about assessment and taxation. This is actually a highlight of the year because it's always good to see everyone's faces and see the budget committee. I know the budget committee puts a heck of a lot of time and energy into volunteering for the work that they do. So I just wanted to give acknowledgement for the committee. Next slide. So for assessment taxation, we essentially have three divisions: administration, property tax management, and appraisal. And our main mission is to appraise property, calculate and collect and distribute taxes, have the related information to the public in a manner that merits the highest degree of confidence, integrity, efficiency, and fairness. We are a broad service organization mandated by the Oregon Constitution and Oregon law, and collect revenue on behalf of 85 taxing districts. Actually, it's 84 as soon as we finish the dissolution of the no-tie lighting district. It includes local governments, schools, and special districts, and they all provide essential public services to the citizens of Lane County. Next slide. So resources for 21-22. One of our main resources is the CAFA grant. And for those of you who don't know the CAFA grant, it stands for the County Assessment Function Funding Assistance. I always look down and it's a mouthful, but essentially it's a grant that we receive funds back from recording fees, delinquent interest, and earnings on those amounts. It's distributed statewide to all counties. Lane County is a donor county in that we collect more than we receive. This year, we're expecting the CAFA grant to be about 15 to 16% of our expenditures. Originally, when the CAFA grant was started, it was around 35%, 40%, it never was indexed. And I'll get into that a little bit more later on in the slides. We also have tax penalties that we collect on, foreclosure penalties, late filing penalties, some miscellaneous sales of data, OHCS fee revenue, that's the Ombudsman program, community relations program for manufactured structure homeowners, service charges, and then of course the majority of our funds do come from the general fund. Next slide. So the budget details for expenditures for this upcoming year. One of the exciting things that we're adding, and in fact, I was just emailing back and forth with the representatives for Data Cloud, which is the company that runs Mobile Assessor. And I'll get into that a little bit. And there also was a budget committee question regarding Mobile Assessor. And I just emailed about an hour ago the return on investment detail sheets. So I hope that answers the question regarding the ROI on the mobile assessor product. Other expenditures, pretty much normal increases in M&S and staffing beyond the deputy assessor coming on. Last year we had him as a partial year. This year it's a full year, and he'll be here the year after. And then we'll have a hopefully a transition depending on the election, as I will be most likely not running for a second term, or I'm sorry, third or fourth term. So there's no main FTE changes for 21-22. As usual, we currently barely meet minimum statutory requirements for staffing, and we're far from optimal level for staff. Department of Revenue has done a study, and they indicated that we need at least 72 staff members. We have 50 right now. I think we can get by with maybe 60, 64 staff members to be fully efficient and do full reappraisal. But we're still far away from that after we lost budgeted positions in 2011-12. We have been very efficient in using our resources, and we always look for new ways to increase productivity, quality of work, and output. Next slide. So 2021 in review, some of the pandemic impacts. We've done limited appraisal. During the pandemic, people really don't want us knocking on the doors and inspecting their houses. We've done the new construction permits and the requests for reviews and other miscellaneous inspections, but we did not do the full reappraisal area that we were planning to do in the Thurston area. We are continuing on with our multifamily housing reappraisal project. We'll see how much that gets completed this year. We've had limited public assistance during the pandemic. One of my goals was to keep the public assistance at least open where they can knock on the administration door and grab someone or ring the doorbell, as far as in our public service customer service area, that they can get a hold of someone with the staff that we do have in the office, since a large portion of staff has been working remotely. We are bringing staff back next Monday, because we have the trimester payments, the May trimester payments due. And so we'll be transitioning staff fully back, with the exception of a few staff members. Projections. I'll go to expenses in a second. But projections are really hard to do. And there was some mention as far as projections of what we're looking at for tax dollars for future years. That's a common question for most taxing districts. I was just on the phone with one of the fire chiefs, and being in an area that is not as urbanized as the Eugene Springfield area, their projections are different than the Lane County projections, which is different than Springfield and Eugene. So some of the items that we look at in projections are some of the positive influences on the tax roll and the market. And the tax roll positive influences, we have such low interest rates right now. They're historically low still, low inventory of existing homes, low inventory of buildable home sites, low inventory of new homes. Population growth is still growing, and there's a lot of government funds out there right now flowing out. That contributes to a positive influence on values, primarily on residential and tract values. We're seeing probably about a 10 or 12% increase generically overall for this next year. We just finished the time trend for residential properties. And so the residential properties are screaming along. They're pretty strong. Some of the areas that we haven't finished looking at yet are the commercial industrial properties. And some of the areas that we're looking at that are potentially negative influences are areas such as hotels that have been hit due to the governmental restrictions, restaurants, gyms, believe it or not, airlines. We do tax airlines. It's through the utility roll from the Department of Revenue. Regional malls, as we see a fundamental shift in people's use of malls and what they're looking for, moving online. Office space, as businesses are looking at having workers continue to work at home. That's going to have a fundamental impact on office space and the available office space, which will impact the rents, which impacts the value of those properties. Business personal property, we've had businesses go out of business and liquidate their assets for the current tax year. And also the Department of Revenue state appraised property. The Department of Revenue state appraised property is kind of a wild card because they're looking at economic obsolescence for some of the manufacturing plants and other plants, and we aren't sure exactly what those are going to be this year. So in other words, we're still analyzing the numbers. Collections was initially a real concern to us. When we first started analyzing the data from the pandemic, when it started, we were thinking that collections were going to be hit pretty heavily. Actually, we haven't been hit pretty heavily with collections. We were pretty much on track, close to prior years. That's due to many factors. Another impact is appeals. We suspect to have, we had less appeals for this current year, but this upcoming year, with the assessment date being January 1st, 2021, and that encompasses the majority of the pandemic, we do expect further appeals, especially on the commercial industrial side. Values, again, went about values. We aren't sure on some of the values. We will have that analysis done probably in a month or two, and we will have it publicly certified on usually October 5th. And legislation has been a big component this prior year and this year. There's several bills dealing with the pandemic and dealing with the wildfires that we're working with, which will have an impact on revenue and potentially collections. So next slide. So the holiday farm fire impacts. Certain districts are being hit heavier than others. The districts obviously that were in the fire areas will be impacted in current and future years. Overall, the county and all districts will be impacted due to prorations of property taxes. And in fact, there's a legislative concept that's been pushed by the assessors and tax collectors and had been received very well, House Bill 2341. That is reworking the way we do prorations so that they're more equitable and actually show a more, how can I say this, just a better refund as far as equating to what was destroyed on the property. And so we expect that to pass. We'll have to do the prorations again. We have approximately 500 or 400 or some odd houses destroyed, about 700 total, including structures. And so we've spent a lot of time as far as with those MAV adjustments, the maximum assessed value. Again, secondary projections due to legislation. There's not only the House Bill 2341, but there's Senate Bill 464 and House Bill 2247, all dealing with the pandemic and or the holiday farm fire. Shifting of resources. We've had to shift resources to do the prorations and to have the inspections and use the resources we have to determine what's left on the properties due to the holiday farm fire. And again, projections. It all comes into the projections as far as what we're looking at for current and future years is in revenue. Next slide. Capital improvement plan. Main area for the capital improvement plan that we're looking at are two areas. One is our software system. I won't read all the components, but as you probably all know, our software system is dated. It was originally implemented in 98, 99. I was a part of the team that went and looked at software systems in 96 and wrote the RFP for the original one we have now, and it is outdated. Our software vendor, Harris now, Thomson Reuters sold the software that we have to Harris Software, has essentially put our software into maintenance only mode and releasing hot patches, minor fixes, but we are actively looking for a new taxation system and assessment system. Next slide. Mobile assessor software. I talked about this briefly. Essentially, it allows a digital property record to allow the field appraiser to make real-time changes out in the field, eliminating office data entry. That's a big piece right now where we have appraisers out in the field doing work on paper. They bring it back in the office and they re-enter it into the system. The ideal solution would be to have it done in the field completely and just reviewed as it comes in electronically. And so we're moving in that direction if the funding is approved. We're also looking at improving our workflow management system as the mobile assessor software allows for including GIS and GPS to get a picture of the properties and upload them automatically to our tax roll. So it just saves time and allows us to do a heck of a lot more work. Not heavier work as far as, but just the production should increase. And again, the ROI sheet that was turned in to the budget committee details that out. And if anyone has any questions on that, please feel free to email me or ask the group for a group question. Go ahead and go to the next slide. So administration, and I'm going to speed up a little bit here because I tend to wander off a little bit. So administration, we're pretty much the direction of the department, operational oversight, budget, interdepartmental relationships, coordination of the sections, support, personnel issues for the sections, and also the public information website, which will go a little more in details on the website in a future slide. Next slide. So this is a few pictures of administration, and they all actually do have significant meaning. One is on the right-hand side, you've seen the dollar bill probably many times where we get 10 to 11 cents on the dollar for all the work we do. The 6 foot is representative of COVID as far as where it has impacted us. The slide that's or the area that's kind of hard to see is the number of accounts that we have in Lane County and the FTE as it compared. And you can see that we're way in the bottom as far as we have more accounts per FTE currently than any county in all the 36 counties. And then also staffing at counties below the $2 permanent rate. There's a little chart that shows the staffing at those levels. Next slide. So some of the highlights of last year's outcomes. We hired, or this year's outcomes actually, we hired a deputy assessor, and it's working out wonderful so far. We, of course, had a timely certification of the tax roll, and that's really important as far as people overlook that, but all the work goes towards certifying the tax roll on time, accurately, and being able to get the tax statements out on time, because without that timely certification, it has ripple effects to everyone, including the county and all the districts. We have a new assessment taxation strategic plan, and that plan includes accuracy of property data, communication, documentation, mental health and wellness, and technology. And those are the areas we're looking at And of course, that ties into the county's strategic plan. But those are the areas we're focusing on very aggressively as far as to look at our next 5 years. This will be my second 5-year strategic plan. Again, prorations due to the fire, projections again. Legislation is always ongoing. We have scanning. We have been scanning and scanning and scanning. Our goal is to get rid of paper and have digital copies of almost everything. We'll see if that is accomplished, but we'll try to do the best we can. Training is always out there, as we're always having cross-training and training staff members that are new or staff members that are working and backfilling positions for promotions. And of course, COVID-19, as everyone else has indicated, that has been a major, I would say inconvenience, yes, a major disruption for this current tax year. Next slide. So some future challenges and opportunities. Some challenges include our dated records. Some of our records are about 30 years old, legislation, limited staffing, again, the CAFA grant, appeals and staffing to have those appeals, process changes, the COVID and fire impacts potentially on the property tax roll. We do have some one-time investments. The one-time investments is an opportunity, which is assessment and taxation software, which is a great opportunity to move forward with our business processes and be more efficient and effective with the tax dollars that we do have. We completed a microfilm, microfiche scanning project. I'm going to break up here and ask Danny if you could log on. How many, or Tara, how many documents did we scan with the microfiche, microfilm? Hate to put you on the spot here, or I can get to this, answer the question later, but I know it was in the millions as far as the documents. It's quite a bit.
This is Danny. I was just going to say, I think we were counting it in file cabinets, and there's probably almost 30 file cabinets that have gone to the warehouse.
That's wonderful. It really is. So again, mobile assessor, thank you, Danny. And A&T funding is always an area we're looking at for the legislature and other ways to fund assessment taxation beyond the general fund. Next slide. So appraisal. Appraisal is responsible for valuing all property at 100% of real market value. And that's tested by the ratio study done each year and be verified by the Oregon Department of Revenue. We also do personal property valuation, do the appeals, Measure 50 calculations in the ratio report. We're always doing subdivisions, partitions, boundary line adjustments. We're on a limited reappraisal cycle, with the exception of this year with the pandemic. Always having taxpayer assistance both at the counter and in the field, where it's really important because we're the liaisons to the county out in the field. And this is a very important aspect when the appraisers do out in the field, and also to maintain property inventory. Go ahead and go to the next slide. Just a few pictures. You might recognize the new hotel across the road there, and some new construction of apartment complexes, a little slide from the ratio study this year, and then some Holiday Farm fire pictures. This is an interesting picture because it has properties that weren't destroyed, and then right next door had properties that were destroyed side by side. Next slide. So highlights of our outcomes. Again, 100% of real market value, 4,500 property inspections, and that's permits, requests for reviews, and very limited, if any, reappraisal. So that's just the permits, callbacks, and other property inspections. 2,300 property changes. Those would be subdivisions, lot line adjustments, partition plats, boundary line agreements. We did approximately 3,700 sketches in our system. That was a project that we did to keep staff productive and busy during the when they were at home during COVID, along with other work that we normally do. We've been auditing personal property accounts. Our appeals are actually this prior year were lower than expected, which is great. And then of course the ratio study, the act of God operations, and we're always doing staff training. Next slide. So future challenges and opportunities. Again, with the deputy assessor, as we get out of COVID-19 and move forward to a normal, hopefully normal business cycle, staffing and training, again, legislative training, appeals, data cleanup, and looking at outdated inventory, business process review, and funding. Next slide. So property tax management. Property tax management is essentially creates and maintain accurate and current records of tangible property and associated ownership to produce updated maps, apply special assessments, manage use assessments, administer state deferrals and exemption programs, provide information, bill, collect, and distribute property tax monies for the citizens and districts of Lane County. We expect again to have all the staff in the office, all the staff by June, but hopefully most of the staff by May 10th, and we will be open to the public. We'll open the public next week. We're looking and have been working with paperless billing, and that is one of our metrics, and I'll get that to the end if I don't talk too long here. And we also have been working on, of course, the property tax management. The accounting side has to calculate the prorated refunds for the wildfires. And then if the legislation for House Bill 2341, we'll have to recalculate the refunds to the additional funds that were provided to the property owners from that legislation. Next slide. A few slides in property tax management here. We did add a new Dropbox this prior year. Right next to elections Dropbox, we have a dedicated Dropbox to help the paperless process, or not paperless, but touchless process. Next slide. So highlights of this year's outcomes. Again, COVID-19, paperless billing. People have the option to opt out of receiving the property tax statement in the mail and receive it via email. Again, certification of tax roll. We did an exemption review project. We're always looking at the internet and website data because we'd rather have people find the answers themselves on the internet than having to spend staff time, so we can do other projects. Again, prorations, training, legislation, and scanning. Next slide. So some future challenges and opportunities. Many are very similar to the other challenges and opportunities. And so I won't go ahead and go through and read all those areas there. One of the ones I wanted to touch base on really quickly is working closer with the other Lane County departments. And that is part of our strategic plan. We really want to work closer with, say, Public Works and all other departments, so make sure we're most effective and efficient as possible. So we're not sending people back and forth between departments, and we're actually trying to help people out as much as possible to direct them where they should go, and being collaborative with all the departments in Lane County. Assessment taxation with Lane County. Next slide. So the strategic plan. I'm not going to read the strategic plan, but the bottom line is assessment taxation is very, very important for the base of Lane County's strategic plan, because we collect the dollars that everything else is built on. And without an accurate tax roll, without staffing, there's a potential for lost tax dollars. And many people from the community do rely on our data for their day-to-day work, from appraisers, realtors, RLID. We have a great relationship with Lane Council of Governments, and you can see the other people and partnerships that we partner with on the right-hand side of the slide. Next slide. Performance measurement. So one of the measurement metrics was to have additional people sign up for property tax paperless statements. We started this prior year, and they had able to opt in. It helps reduce mailing costs, and also falls under the safe, healthy county category, saving the taxpayers money of Lane County. Also, it saves resources, so the bonus. Number of real property accounts reappraised. All property must be appraised again at 100% of real market value. This contributes to, again, maintaining robust infrastructure and a responsible stewardship of the property assessment and vibrant communities by maintaining accurate and equitable property data. The last one is property records account sketched. We are about, I think last time we checked, we sketched about 120, maybe 120,000 accounts. I'm not 100% sure on that, but we have about 160,000, and then you count the miscellaneous accounts, so about 20,000 left to sketch. And so as we sketch properties, we clean up our data, and we again allow for the public to easily find data on our website that they can use for their purposes. And I think this might be the last slide. It is. So questions. Sorry for taking long at the start and then kind of going fast at the end, but I wanted to make sure I allowed time for questions.
Excellent. Questions from the committee members? Commissioner Burney.
A few really direct questions. Mike, will the software, I've heard you talk for a long time about needing this software, will that bring in more tax dollars to the county?
The mobile assessor or a new software system for the county?
Take your pick, the one that you have listed there. I'm trying to understand, because I know you're understaffed. You've sat down and walked me through it. I know there's a relationship between that and bringing in revenue to the county. And so I'm wondering, will the net effect of this be to bring in additional revenue to the county?
So the mobile assessor, it makes us more flexible, and it allows staff to look at many more properties than we would. So that would potentially bring in more revenue. We would find more omitted property. We would find potential clerical errors, adjustments to the tax roll, and have a chance to review and look at properties that we wouldn't have gotten to without that software. As far as for our computer system, it's hard to say if that's going to bring more revenue or not. Really, as we look at the RFP and write it, since I have a little bit of experience writing the original RFP, I know what we're missing. And so there's areas that we are lacking in our current system that would help out with data consistency, clerical errors, potentially between transferring values between the two systems, because we'd have one system instead of two systems. So potentially that could also generate additional revenue, but that's a speculation at this point in time for that.
Thank you. And two more questions. One, since you don't know how many terms you've served, I promise not to tell anyone that. If you could delay reassessing the Thurston area, which you said is next up.
I think it is next up, yes.
And finally, and I'm asking this not because I don't understand and it impacts revenue to the county. I have a friend, I can't mention him. His mailing address is Springfield, but in fact, he's one of Commissioner Buck's constituents. His home is now for sale for approximately $1.5 million. And he pays according to the Zillow listing, he pays $218 a year in taxes. Can you explain how that could possibly occur?
The only thing I could think of would be, is it a brand new house?
No, it's a 50-year-old house.
So either they're looking at
the original owner, yeah.
Okay, either it's a clerical error and we need to make sure, put it on the tax roll. Again, that's why it's important to go out and do reappraisal, because properties do drop off the tax roll you know, occasionally due to appeals that are due to many different loss of permits maybe. But a lot of times what I find when someone has a very low tax bill like that, they have two tax accounts. And one tax account that's pulled up is a code split account. And the second tax account is where the improvements lie. And so if offline you wanted to provide me the address, I'd be more than happy to provide multiple details about the property.
As a commissioner, I should. As a friend, I don't want to give you that. But no, thank you very much, because I didn't understand that. And thank you. Thank you, Jared. That's it.
Yeah,
thank you.
Yeah, you can't trust Zillow on everything. So.
Well, yeah, but that's a big one.
Yeah. Okay, other questions? Commissioner Farr, you got your hand up.
I just have to hop off. I'll see you all tomorrow. Thank you.
Thank you, Laura.
Thank you.
Commissioner Farr, do you have your hand
Thank
up?
you, Chair Bloodman. Thank you, Chair Bloodman. Just this to mention that since we first appointed you, Mr. Coles, nigh on 8 years ago, you've been aggressively trying to reappraise. That's been a subject every single time you talk about taxation, and the mobile software is going to certainly be an asset to your goal. You have a goal of 100% reappraisals. That's lofty, but you're far from it. The other thing I'll say, Mike, is it really is a pleasure working with an assessor who's done virtually every single job in the office before you were appointed and then subsequently elected twice to a tax assessor. I'm proud to work alongside of you with your professional background and also your statewide leadership that you provide. Thank you.
Thank you, Pat. I really appreciate those comments.
Other questions for the assessor? Okay. Thank you, Mike.
Thank
Really
you very much, everyone. Thank you for your time.
You bet. Okay, let's see, we have some committee business. Budget staff, do you have anything that the committee should know about?
I will just let you know that minutes will be for May 4th and 5th will be coming to you probably tomorrow afternoon. So right now you're scheduled to approve those on May 11th, but if you need more time than that to review them, just let us know. And you will receive answers to questions that we have so far later this evening. And then we'll send out updated agenda and presentation like Tanya has been doing each evening today after the meeting. And that's all we have.
Excellent. Before you drop off, Ms. Moody, there are a lot of, I was just looking at the questions. There are a lot of questions. Are we, is the committee being okay in the questioning process? That's just a lot of questions. I want to make sure that there's not an undue burden. I guess that's kind of throw it out there.
So we are doing our best. I guess I would say that, you know, if a question, I think you already mentioned it today, Chair, that if a question does take more than the 15 minutes, then we will give that information back to you. Some of them will be, I think some of those questions will be the information is somewhere else in the materials. So we'll provide that to you. Yeah, we're doing our best. It is a lot. Yes.
And I would say that would be following the guidelines that we've already set out for the committee. If there are questions that are answered there that even in the sum of them starts to create a burden, I think that that's something this committee can talk about. So please bring those to our attention. And Commissioner Buck, did you have you had your hand up there for a second? Do you have something?
I just wanted to concur that I'm finding that the amount of questions is really challenging for staff, and it might be something that we as a committee need to discuss and figure out how to go about making sure that that is manageable from year to year, and ensuring people have read the material before questions have been fully asked.
I agree. Commissioner Farr.
And just to put that in perspective, Chair Bloodman, if we ask, let's say we only asked 80 questions among us. Let's say we only asked 80 questions at 15 minutes apiece. That's 1/2 of a work week for somebody. So, you know, to put it in perspective, that's a lot of time and resources from staff. Not that every question may take 15 minutes, but if it were to, and that's if we only ask 80. I don't know how many have been asked.
Commissioner Burney, you had your hand up?
Yeah, I just want to concur with the preceding two commissioners. I think being in this role, you become a little sensitive to the demands, the weighing the balance of the demands for accountability, and yet at the same time, the incredibly how stretched staff are under these particular circumstances that we've all been talking to. So I just want to agree with Commissioners Buck and Farr on that point.
Excellent. And I actually, with that said, there are a lot of questions in there, but we're all on this committee as well. And so if you have questions, we still need to have room to get those in and to have staff time to be able to do that. Realistically speaking, so please, we've got important business to do here. If we have questions, the rest of us need to get some in there too, if needed. So take that into consideration. Any other questions or comments, Commissioner Buck?
I appreciate that because I feel like we need to be able to have an equitable amount of questions per person if they come up. I mean, it's going to fluctuate depending on how long people have been on the board and understand the material versus those that are new. But if all the questions that have come in are for one person, it takes the whole entire few weeks because nobody can do that, answer questions for a solid week. Where should we provide some sidebars? And we don't have enough time to talk about it today, but it would be nice to maybe fill in one of these work sessions about the equity portion of questioning.
I think what I'm hearing from the group here is that we should get that onto for committee business on Tuesday to kind of put some guardrails on ourselves and get some manageable pieces going forward. So, okay, I saw a thumbs up there and a couple nods. So we'll do that under committee business on the Tuesday meeting. Any other topics? Yes, Mr. Weber.
Well, I just wanted to point out to Christine and her group that I think this budget buddy is a great idea. And I've reached out, and Dan Hurley and I've already talked, and we're going to get together on Monday. So, because there's just so much information to understand how it, and I've known Dan for quite a while. So this should be I'm looking forward to chatting with him for a couple hours. So I just think it's a great idea.
Great. Glad to hear.
Good to hear that. Anything else from the committee? Okay, next meeting is on Tuesday at 2 p.m. and look forward to seeing y'all then. Thank you for sticking with us.
Thank you. Goodbye.
Thanks. Bye.